Well, good morning, everybody. It's 9 o'clock on a Tuesday, so that means it's Impact and Coffee. And I really appreciate that everyone tried to spend some time with us today and talk about a very important topic, which is homelessness. And we have some very special guests, which we'll get to in just a moment. But just a heads up, if you're entering into the room, please mute yourself. That would be really helpful as we are getting settled here for just a moment. I'm Robert Nelson. I'm the program manager for Pivotal New Mexico, not the Grants Collective anymore. We changed our name last Thursday. And my co-host, our lovely co-host this morning is Mariah Harrison.
Good morning, everybody. Thank you for being here.
And just a big shout out to the Impact and Coffee team, Destiny Logan, Aaron Hilkema, Michael Green, and Jamie Chester and Juana Beta. I know Jamie and Juan may not have been able to make it today. They had some other prior commitments, but those are the folks that make Impact and Coffee happen thrice monthly, the first 3 Tuesdays of the month. Typically at the Albuquerque Community Foundation, but obviously we have this thing going on called a pandemic. So we want to make sure that we're safe and that our audience is safe as well. Mariah, could you tell us a little about Impact and Coffee?
Sure. So Impact and Coffee has now been going on for about 4.5 years already. And for those of you that have never been, originally we based it off of the group called 1 Million Cups, and we turned it into a nonprofit organization or platform for organizations to come and talk about what was innovative and what your programming was doing, what challenges you were running into, and very much make it an open, welcoming space for people to talk about their personal experiences and also ask for help from other organizations in the community at large. And so one of our questions is always related to how can we also help you at the end of the day. So it's different every single week, and we've had some really incredible speakers, and I'm glad to be a part of it. We have a great crew. And for those of you that are still joining us, and we'll repeat it again, feel free to put in your comments and your questions into the chat. Use it richly. And then any resources we pull from, see in the chat, we'll be able to edit that and add it to our YouTube posting later so that people can also see what you added in. And if I may, I'll ask our speakers to add in their contact information and organization website as well.
Awesome. Thanks, Mariah. That being Tuesday, it is Gratitude Tuesday. We like to practice a little bit of our, do a little bit great gratitude practice this morning. Is if you have anything that you are grateful for in your life or in community, let us know in the chat function. Mariah, is there anything you're grateful for?
Today, I'm just really grateful for having a circle of friends and family that are supportive of one another and vocal of what's happening around the world right now and in our country. I really love that I don't have shy friends, and they're encouraging me to be a bigger, stronger person too.
Awesome. Thanks, Mariah. I'm grateful for all of our community who is out there in our streets the last couple of weeks, especially our youth. Youth are taking the lead to advocate on behalf of Black lives, and I think that's an amazing thing. And for those of you who didn't watch last week, please take note. We are still asking for calls to the governor's office and the mayor's office to free Clifton White. He is a political prisoner. He was literally kidnapped from his family for being a Black organizer in our city. So call our governor, call our mayor, Mayor Tim Keller, and release Clifton White. He was just organizing. And if you see the news, they've been telling it about trumped up charges about violating parole. That's not true. And so we all know that when you're a person of color or Black, then you have a different people view you differently. And so we want to make sure that we're saying our best and standing in solidarity with Black Lives Matter. So with that, we would love it if our panelists would introduce themselves, take about 2 to 3 minutes to tell about who you are and your organization, and then we will jump right into questions. So I'm going to go with, actually, to the person on my left, who's Edward. Good morning, Edward, and welcome to Impact and Coffee.
Thank you, Robert. It's great to be here. Appreciate you inviting me today. I'm the Executive Director of St. Elizabeth Shelter for the Homeless. Actually, our official name is St. Elizabeth Shelters and Supportive Housing. We have 5 different facilities here in Santa Fe. We are the largest agency in northern New Mexico, largest and oldest agency in northern New Mexico that house and work with the homeless. The 5 programs we have a men's shelter, with about 28 beds. We have a women and children and family shelter called Casa Familia that has about the same number of beds. We have a 28-unit apartment complex for the disabled, single men and women. It's called Casa Cerrillos. We have an 8-plex for seniors, 55 and older, and then an 8-plex of 2 and 3 bedrooms for families. So we're quite a large organization. We house about 125 people a night. We serve a little over 2,000 people a year. So that's about it about St. Elizabeth. So thanks again for having me.
Thanks, Edward. I appreciate it. Right next to me, to my right, is Hank Hughes. Good morning, Hank, and welcome to Him Back in Coffee.
Thank you, Robert. Yeah, thank you for having me. And I work for the New Mexico Coalition to End Homelessness. I'm the executive director, and we are a little bit behind the scenes in terms of being the backbone services for a lot of our member agencies, including St. Elizabeth's and Healthcare for the Homeless. We provide the data system. We operate a coordinated entry system. We coordinate the advocacy at the legislature and sometimes at the local level. And then we also coordinate the big federal grant program called the Continuum of Care. And so this year, the Continuum of Care funding from HUD, they've allowed us to divert some of our resources to actually assisting with the COVID crisis. And so that's been interesting. But that's pretty much who we are.
Thanks, Hank. Appreciate it, and welcome again. And last but certainly not least is a good friend of mine, Anita Cordova, over at Healthcare for the Homeless. Good morning, Anita, and thank you so much for being here today.
Good morning, Robert. Thanks for having us. I'm honored to be here with everyone this morning. As Robert said, my name is Anita Cordova. I have been with Albuquerque Healthcare for the Homeless for the last 14 years. It has been an honor and a pleasure to serve the population of people experiencing homelessness. At Albuquerque Healthcare for the Homeless, not only do we work to address the health-related causes and consequences of homelessness through integrated and comprehensive behavioral health, medical, oral health, social services, and street outreach care, we also work to fight to end that homelessness through a very strategic advocacy platform that is very assertive and intense and intentional in how we work to address homelessness with our community decision makers and policy makers. And of course, we do that in partnership with New Mexico Coalition to End Homelessness, Supportive Housing Coalition of New Mexico, and many, many others. Nothing we could do. We certainly can't end homelessness alone, and we're grateful for all the partnerships, many of whom are represented on this call this morning. So I really look forward to a rich and deep conversation. Thank you, Robert.
Thank you so much. And just to also flag again, if you have questions, I see a lot of really great comments from Gratitude Tuesday. Thanks, and we're so grateful for all of you too. If you have any questions, please use the chat function, and we'll make sure that we can try to lift those up as best as we can as we go through the conversation. The first question, we'll just dive right in. We know that this has been a challenging time for a lot of different nonprofit organizations, small businesses, and even government in the last 2.5 months, almost 3 actually. And especially for our unhoused. Could you talk a little bit about the challenges your organization has faced, your community has faced in the past 3 months? And we'll start with you, Edward.
Sure. This has probably been the most challenging thing I've ever had to deal with in my life, because we're talking about people's health and lives here. When the pandemic first hit, the mayor of Santa Fe told us we had to move everybody out of our shelters. So we had to move 60 people, men, women, and children, into motel rooms. So I said, okay, fine, who's going to pay for this? So fortunately, the city and the county came forward and said that they would pretty much put up the money for it. But then we couldn't find anybody who would take us. They suggested one motel down the street. I went and met with them. First, they said, yes, you can move in. You can start moving in tomorrow. I got a call from them later on that day saying, well, we changed our mind. We don't want you. We had to call several places before the mayor finally stepped in and used his authority to basically just tell one of the motels in Santa Fe, here, you're taking these folks. So then we had to let everybody know. They had to pack up all their things. We had to move into the motels. I had to put up some staffing there. I stayed there for the first couple of nights. We had to start providing food, delivering 3 meals a day to them. It was quite an ordeal. Like I said, I've never had to deal with anything like this. The first couple of nights were pretty rough. As a matter of fact, the first night we had one gentleman who has a drinking problem. He went on a binge. He got up in the middle of the night, went to the front desk, terrorized the front desk staff. They had to call the police. He barricaded himself into his room. It was something. I was up all night that first night dealing with that. Things finally settled down, but my biggest concern then was just the health of everybody. I begged different agencies around town to test us because I had no idea. As you probably well know, the homeless are very susceptible to to different types of diseases and stuff. There's not much social distancing, but we were finally able to get somebody to come to test all the guests. We had 55 people tested. Fortunately, everybody came out negative. So it's been quite an ordeal.
Thanks, Edward. I really appreciate that story. I think it highlights just a lot of the struggles of nonprofit organizations in the last 3 months, especially just trying to be nimble and flexible and be responsive for our communities. Thank you.
Sure.
Hank, what about you?
Well, our story is nothing like Edward's, and I'm sure like Anita's, because we work, as I said, a little bit behind the scenes, but we did at first, of course, have the struggle of switching from our offices where we were all sort of packed in together to working from home primarily. And that threw everybody for a loop, set us behind a bit. And then we were, kind of stuck with the challenge of how to support, our many member agencies around the state during this crisis and how we could get, resources out. We did get a grant from the National Low Income Housing Coalition and a grant from the city of Santa Fe. And so we were able to put some homeless people who were, particularly vulnerable up in motels using that money. We partnered with our partner agencies. And in Santa Fe, we actually sort of just piggybacked on St. Elizabeth Shelter using the same motel that they had gotten through the mayor's auspices to put up a couple extra people who we knew of who were particularly vulnerable. But that was, the struggle was that then when we were doing all that, then we weren't even doing the part of our work we were supposed to do, which is assessing people for housing. So in the last month or so, we've been trying to figure out how do we sort of, at the same time we're trying to help our member agencies keep everybody safe, how are we also assessing people for housing and trying to move people toward permanent housing. So that's been it's been a little bit of a struggle, but not the late nights that Edward has had to pull.
Thanks, Hank. Appreciate that perspective. Anita?
Yeah, first let me apologize. I have a dog going a little crazy behind me, so if you hear loud noises, my apologies. Challenges. We have faced many challenges over the last 3 months. Albuquerque Healthcare for the Homeless will be 35 years old this year, and we have been the public health response to people experiencing homelessness since the beginning. So for us, this is what we do. However, we've never done it in a pandemic, and we generally don't do it from our homes, and we generally don't use telehealth. These are just some of the things we have had to dive into in a very exciting way. As far as learning that we can do it, telehealth was something 3 months ago, if you asked us 4 months ago if this would be something we would ever do, we would say hands down no, with all the complications of people having access to telehealth. We are more of a brokering of telehealth model right now, taking technology to people and getting them back to our providers who are working at home or in the clinic. We have had to de-intensify our clinic itself, which means making sure that 55% of our staff are now working off-site so that we could provide some safety and security for clients and our clinicians so that we don't get each other sick, especially during the beginning of the pandemic when we weren't sure, right, how this was going to roll out. In addition to that, We did have to close 2 programs, our Art Street program, which is a community-based art studio program, and our drop-in center, which usually served about 100, 150 people a day. Again, to make sure that our campus could stay open from the healthcare perspective and we could continue to address healthcare needs. We had to pull back some of our oral health services, especially hygiene. However, and importantly, we were able to stay open and provide emergency oral health care to keep people out of the emergency rooms with dental pain. I think that was super useful, especially as our hospitals began to get filled with people experiencing complications from the COVID virus. And it did, so when we had some extra staff from the programs who closed, we deployed them to the streets so that they could provide street medicine and street care. Been out on the streets, being responsive. Our harm reduction coordinator has a phone that we are able to go out onto the streets if someone runs into someone who might have a fever or any other potential symptoms of the COVID virus, and or if they need any other care. So it's what we do amplified, and that has been the exciting part. We don't anticipate are rolling back from what we've learned from this process, and we're very excited to be able to be out there and provide the needed care. As you can imagine, we were very concerned with housing, and we're grateful for organizations like the New Mexico Coalition to End Homelessness, and I know we'll talk about partners here in a little bit and can talk about some of the exciting solutions that happened as a result of the COVID virus. Our community has really come together strong, and that's something we should all be proud about right now. And it has indeed had a positive effect on not spreading the COVID virus throughout the community of people experiencing homelessness. Yeah, so I think that's enough challenges and kind of how we've overcome some of them.
Thanks, Anita. I appreciate that. It's tough all around for a lot of folks, especially for the folks that are experiencing homelessness more than anything. I'm going to kick it over to Mariah just to ask our next question.
Thank you, Robert. And I think that's actually a really good transition, Anita. Thank you for that. I also want to respond to the concept that you're amplifying your work right now and that you're not rolling back based on what you've learned. I think a lot of people are learning some really critical lessons now, and it's great to hear that you'll be able to provide even more critical, acute help based on this learning experience. And so some of that may or may not have come from working with other groups, but our next specific question is, how has your organization partnered with other groups to address these challenges or one another's needs? And if you have suggestions for organizations or people or businesses that want to work with you, what are some really great ways that they can approach you for that, or ideas you have for new partnerships? So first, let's talk to Edward. As you worked with other organizations, tell us a story about that in the last couple of months, if it's changed or grown.
We work with a lot of different organizations, obviously, around town. There's, city, county, state agencies, other nonprofits, Healthcare for the Homeless, Coalition to End Homelessness. The two that we've worked with the most during this whole situation has been the Coalition to End Homelessness and Santa Fe County. Like Hank said earlier, they have been sending folks to the same motel that we had our folks. And since they don't do direct services like we do, we took over case management for them. So anybody that was placed in the hotel by the Coalition to End Homelessness, my staff, case managers, and working with them on the whatever needs they needed, medical attention, helping them get into housing, whatever. The other organization or agency we've worked with quite a bit is Santa Fe County. The Santa Fe County Commission allocated $50,000 to help folks with rent, utilities, and just not the homeless, just pretty much anybody in Santa Fe County who needed help. But they could not administer the funds themselves, so they asked us if we would do that for them. So they gave us $50,000, and their navigators are working with people throughout the county to help them get whatever they need, but they refer them to us to actually cut the checks and help them get whatever they need. So that's a whole new ballgame that we've never dealt with before, but we're very happy to help Santa Fe County with that.
Good, excellent, thank you. Hank, talk to us about how the coalition maybe is operating at a higher rate right now and what you're doing with your partnerships.
Yeah, so we are, as a coalition, we're made up of about 80 agencies around the state who we work with. And I think one of the things we recognized at the beginning of this, disaster pandemic was, the lack of help for people in rural areas. So when we got a grant from the National Low Income Housing Coalition, we reached out to our partners in some of the smaller towns and asked them if they wanted some of this money to house vulnerable homeless people in their communities. And so we're now partnering with, I think, 6 agencies in places like Alamogordo and Socorro, Las Vegas, Taos, and I'm forgetting and Hobbs is another one. So, when we looked at the landscape, we realized that the cities of Santa Fe, Las Cruces, and Albuquerque, had kind of their own money to step up and help, just like Edwards mentioned, Santa Fe County putting $50,000 in, but smaller communities don't have that kind of flexibility. So, we've been able to provide a little bit of money to these communities so that, and in most of them, there's a group of volunteers or some agencies that work in mental health or healthcare, and they all tend to know the 2 or 3 homeless people who, hang around their communities and, we're older and had health problems that they needed to house. So that's the main thing that we did a little bit differently and expanded on this time.
Expanding your reach, that makes a big difference to every single person. Yeah. Anita, how about, the work that you do to accomplish is incredible, and it's holistic and wraparound in so many ways. Talk to us about what you're experiencing with partnerships now.
Yes. Well, as you can imagine, when the pandemic started, again, we have healthcare down. That was less of a concern, except for protecting our clinical providers so that they could be present to take care of the health concerns. However, we don't do housing. We do some housing vouchers, but we are not a shelter. We don't do housing. We were very concerned with how people without homes would be able to quarantine and isolate during the COVID virus. Luckily for our state, we were kind of behind the curve as far as people had already been hit hard with the COVID before it got to New Mexico. So we were able to pull from our network of the National Healthcare for the Homeless Council and talk to peers across the country who do healthcare for the homeless projects in Boston, Maryland, Colorado, Seattle, and say, what did you do to make sure that this, to help? What happened? And we were able to learn from them, modify our systems locally, and implement some of their lessons learned that we didn't have to learn ourselves, which was great. Excitingly, we are in Bernalillo County, city of Albuquerque, and had some resources, unlike some of the rural areas that Edward and Hank are talking about. The city immediately and the State Department of Health got together, did some really strategic problem solving. We immediately started convening daily calls at 7:30 and 11 with the city. They, as part of the citywide public health response and already collaborative structures in place, like the system of care at the West Side Emergency Housing Center, we built on those systems to create a response that would help people without homes have adequate places to isolate and quarantine. So the partners in that, City of Albuquerque, UNM Health Sciences Center, the Medical Reserve Corps, of course, Albuquerque Healthcare for the Homeless, First Nations Community Health Stores, other Albuquerque homeless service providers, many of them are at the table during this coordinated response, and then Centro Salvila. Anyway, very exciting opportunity for us to come together and see what can be accomplished when we work as a team. Immediately, they were able to put together, at the beginning, 3 sites, one of them being a hotel, 2 some community centers, and those just continued to grow. I think we are at 4 or 5 community centers and 2 hotels. All of that's going to shift a little as the city starts to open up. The first thing that happened was de-intensifying our shelters, especially the West Side Emergency Housing Center, and putting folks over 50 with co-occurring with chronic health conditions into some of these sites so that they would not be at risk of getting the infection. Or the virus. We also Immediately, anyone who had symptoms got put into a quarantine site and was immediately tested. As you know, we do have some positives in the community for sure, but these efforts have indeed minimized the outbreak in our population of people experiencing homelessness, and it's not been without a lot of effort and resources and infrastructure put into place on the part of so many people and partners in the city. So that feels really good, and we were able to help people without homes not be impacted in the way that really this could have been a really bad situation, right? For people without homes, it could have spread really far and there would have been less resources. However, as it continues to go on, what we have learned from other cities is that it hits the population of people experiencing homelessness at a delayed response to what the general population was experiencing in other cities. So we also are diligently staying on top of what's going on and continuing to talk to people every single day and make sure they have access to care so that we can continue with this successful trend.
It's really, really great news. I'm glad to hear that about the trend and the many partners coming together for the similar purposes. I appreciate that. Okay, Robert, we're going to transition to you for our next question for our panelists.
Thanks, Mariah. What a really great segue. So this is kind of a compound question. So we've seen a lot of funders, especially community foundations, step up and provide emergency funding for nonprofits, and especially PPP with the federal government, the SBA loans. Have you yourself, your organization, applied for any of that funding? What has your experience been thus far? And how can funders be more responsive to community needs during this time? So I'll repeat that question again. Have you applied for any of the emergency relief funding? What has your experience been so far? And how can funders be more responsive to our community's needs? And we'll just go back to our start, Edward.
Sure. Yes, we have applied for funding. We've applied for a lot of funding, and we've gotten most everything we've asked for. It's been phenomenal, the outpouring of support that funders have given us, individual, foundations, funders, businesses, church groups. We've brought in, I figure, probably close to $250,000 in the last 3 months from people. We've got $200,000 from the CARES Act right off the top. Like I said earlier, Santa Fe County and the city of Santa Fe each threw in $20,000 each to help pay for the motels. We applied for money from the Santa Fe Community Foundation. We got some from them, from the New Mexico Community Foundation, Christus St. Vincent and Quorum, PNM. I see that Lori Roach is on today, so I want to say thank you, Lori, personally, for your help and the help that we got from PNM. It's just phenomenal. We've gotten checks from individuals, people we don't even know, have never given us money before, who send us checks for $5,000, $10,000. It has been absolutely amazing. Which right now, who knows, what's going to happen a year from now, I think, when the economy really tanks. So, we're blessed to have these funds now. I'm trying to save as much money as we can for down the road. But I just want to say thank you to everybody who's been so phenomenal in helping us out during this very difficult time. And then I don't know how funders can even be more responsive. They've just really come through. I can't think of any other ways that they could help out other than what they've already done.
Thanks, Edward. I appreciate that. That's awesome news. Awesome news. Thank you. Hank?
Yeah, I mean, similarly, we've applied for some funding and gotten some funding. I think, I mentioned the grant from the National Low Income Housing Coalition, which in turn was them passing through a grant they had gotten from, or several grants they had gotten from national foundations to help with homelessness around the country during this time, and that was very helpful. We did apply also to the Community Foundation. We're working on the Con Alma grant now. I think, as you know, Robert, we've been struggling. There is allegedly this unlimited amount of, or supposedly unlimited amount of FEMA money that can be used to put homeless people in hotels and motels if they're vulnerable. And we're still sort of chasing that. I think we're getting a little bit closer. to accessing that money, but that's been a bit of a struggle just to find out, who's in charge of it, who gets to say yes or no over that funding. So that's been a bit of a struggle. One of the really bright points was the Lineberry Foundation. We were getting ready to apply for a grant from the Lineberry Foundation, and they just said that they had decided they were just going to give everybody they funded last year the same amount of money. No questions asked, no strings attached. So if funders really want to be helpful, boy, that was nice, because I didn't have to, work overtime to write a grant application. I don't have to try and figure out what next month I'm going to need the money for, because there's a lot of possibilities. It's nice to just have some money in the bank that, we can use it to help at the Midtown campus in Santa Fe, or perhaps with some of our rural partners, or hotels, here and there. It's nice to have the flexibility.
Thanks, Hank. I appreciate that. And, I hope there are more funders out there that are listening to that story, because I know that would be extraordinarily helpful for a lot of folks, especially smaller nonprofits who have to, like you said, work overtime sometimes for that grant application. So much appreciated, that perspective. Anita.
Yeah, as you can imagine, we have been extremely busy trying to respond to any opportunities for emergency funds like the CARES Act that Hank and Edward both alluded to. As a federally qualified health center, we definitely had access to some of those funds in the 3 different phases. A little bit of funding for the emergency response and rollout in technology, a larger grant that came down through the CARES Act that was to help maintain staff to make sure that we could continue to pay our clinical providers and support staff to be responsive to the healthcare needs of anyone who might be at risk of the COVID virus or contract it itself. And then recently another small amount of funding came out to make sure we can test and do more testing at the community health center level. So we definitely took advantage of that. As you can imagine, the proposals are fast and furious. There were no proposals, but you had to respond immediately with how you will spend the money. So those have been intense. From the philanthropic perspective, we had to reach out. We are very grateful to Albuquerque Community Foundation, and United Way did an emergency fund that helped us provide to up our game on sanitation. We had to hire staff to be on site during the day to clean and to sanitize our clinic. We usually just had facility staff at night come in after we closed, and then they would clean and we'd do it all over again the next day. But now we have to have a full-time person to do the sanitation. Of course, PPE or personal protective equipment's a big deal for our organization, was from the beginning, and of course now it is for everybody. And then more materials to continue to sanitize are getting more and more expensive, as everyone on this call is aware. So I think that community foundations need to be thinking about those increased costs, and have been really grateful for the outpouring of support. I think 2 things that we keep thinking about: there's been some current funders who have said, we want to give you your money early, which is nice, except we all know that for us, we're a fiscal year organization, so beginning July 1st, we're going to have to fund our organization all over again. So some of this doesn't go away. So we're really concerned about how what is sustainability going to look like going forward. So I think that community foundations need to give more than the minimum 5% and give as much as they can. And I think I'm very, and much like Edward was saying, grateful for the loyal and committed donors we've had over the years who really stepped up, new donors we'd never heard from, who understood, Albuquerque Healthcare for the Homeless, that we were out there really trying to respond to this pandemic. So very, very grateful for the warm outpouring of support, and also encouraged by the understanding from both government funding and philanthropy that this is a serious situation and we will be needing to fund these organizations going forward. And I know this is kind of rolling into the next few questions, but I will also say I think we need to make sure that our funds are targeted, prioritized, and planned around making sure that communities of color are taken care of during and after the pandemic, as not only are they more affected by all conditions, the pandemic has hit hard in our communities of color, our working class, our people without homes, people with homes who are underhoused, and after, once the eviction, the bans on evictions or the holdings on evictions and other safety nets are lifted, we're not sure what that's going to look like. We have no idea, but we can imagine it's going to hit communities of color harder, and we all need to be prepared to respond to that, and funding needs to follow that potential epidemic on a pandemic, I would say.
Thanks, Anita. I appreciate you lifting up that last part, especially. There are no moratoriums on rent and mortgages at the moment, and so and anything's really now at this point a deferral. So folks who still owe money on their rent or even on their mortgage, they have to pay in a lump sum once the crisis is over, so to speak, or whenever that's going to be. So there's going to be a cascade effect for a lot of folks, and hopefully we have the right kind of nets in place, although I know I might be a little skeptical on that front. So I appreciate that you lift that up so much, because we have a long road ahead of us to recovery on this point. So I hope that we can continue to advocate so much more for our social service net. And I will kick it over to Mariah for our next question.
Thank you, Robert. And yeah, that is a really good transition. And I'm just going to take a moment to do some housekeeping. We still have some time and room for you to add in your questions in the chat. There have been a couple of questions posted, and so if our panelists have any answers to those, feel free to do that in the chat. Put in your contact information if you are comfortable, and then anybody who hasn't yet and would like to share their Gratitude Tuesday, please still do. That's quite all right. So our next question for our panelists, and Edward, I'm going to start with you again, is much what Anita was talking about just now. Is this pandemic has exposed so much inequity in our communities, and we'd like to know what your perspective is on what changes that you'd like to see in our communities moving forward. And so the other piece of what you envision for that change is how can we make these changes happen, and maybe even how can our policymakers play a role in accomplishing these changes.
Okay, thank you. As been said before, the homeless are probably the most vulnerable portion of the population in the pandemic. I mean, how can you shelter in place when you don't have a home? So the number one issue that's facing the homeless community is more housing. Like Hank said, it's actually cheaper to house people in homes than it is in shelters. So we really need the community and government officials and foundations and everybody involved is to help provide more affordable housing. Here in Santa Fe, we've hit it's a huge crisis, the lack of affordable housing. And we just need folks who are involved in it to come forward and help us provide more housing. So really, I think that's the number one problem that I see in our community. It's just the lack of affordable housing.
Amen. Hank, go ahead and talk to us about what you'd like to see.
Yeah, I mean, I think, the pandemic, immediately showed the kind of the stupidity of letting thousands of people, have no place to shelter in place. Not only risking their lives and the lives of their friends, but the whole community by, being a potential pool of people to spread it. Like Anita said, it hasn't hit the homeless population in New Mexico very hard yet, with the exception of the Gallup area, where we actually saw what could happen when in their rehab center, one person with the virus spread it to 15 others, who then all went home to their various places around the Navajo Nation and spread it there, to a rather disastrous effect that we've seen in that part of the state. So yeah, really just providing everybody with a home solves so many problems. And most people can take care of their own needs. I mean, if you're in a shelter, I used to run the shelter that Edward now runs, but you have to organize meals and case management and all sorts of things for people. If people have their own homes, they can generally clean their house themselves. They can cook their own meals, and then figure out what to do with their lives rather than be taken care of, or even worse, if they're on the streets and are just trying to survive day to day. That's no way to let people live. I think the other thing that we've really been highlighted by the pandemic is the way that poverty disproportionately hits people who are minorities, and we see that especially in New Mexico among people who are Native American or African American. Our statistics that we look at every year show that African Americans and Native Americans are homeless at much higher rates than other groups, the other groups within our state. And so just highlights the need to pay attention to that and look at how systemic racism is affecting those communities and keeping them from being able to enjoy the benefits that the rest of us have.
Right on point, Hank. Thank you. Anita, let's revisit some of what you were talking about, and if you have ideas on how we can work towards accomplishing more affordable housing and services, that'd be great.
Yeah, thank you, Edward and Hank, for stating the obvious. For Albuquerque Healthcare for the Homeless, housing is healthcare, and just by providing more housing, we can address many of these inequities. The question is, the pandemic has exposed so much inequity in our communities. People providing care to people without homes and housing and shelter have long been aware of this unequal distribution of housing that Hank was talking about. People of color are overrepresented, and in New Mexico specifically, as Hank mentioned, our Native community and Black population is highly overrepresented. Our Hispanic population, probably a little bit undercounted because of living together in shared housing, but I believe if we looked at that, they are underhoused at unequal rates as well. And we have to address this. Albuquerque Healthcare for the Homeless does things like disaggregates our data, who's getting housing. We look at who's getting better. What are the solutions to making sure that we can create some equity in our services? I think everybody needs to be doing that. I think our statewide system, our coordinated entry system, which does some of this, but I think now is an opportunity to double down on our efforts to measure who's exiting homelessness into housing, who's staying housed, who's getting rehoused. I think we need to prioritize housing for communities of color and be very intentional in making sure that that is happening. Communities of color are unhoused at rates that are completely unacceptable in our community, and it's very clear that housing can save people's lives, and all we need is more housing, and then when we have that housing, to prioritize who gets into it so that we can start to create some equity. Affordable housing is more cost-effective than shelters, emergency rooms, even our hotel motel response we have been doing, which has been amazing to make sure that we do not have the COVID-19 pandemic spread throughout the community. It is an insufficient resource for actually ending homelessness. To Hank's point, we have long known that housing is the answer, but the pandemic has shown us that without housing and that relying on institutions like the treatment center Hank was talking about, what we're seeing in jails and prisons, and even shelters across our country, institutionalized living is dangerous when we start talking about public health crises like the pandemic we are currently living through. And just giving people their own space, their own housing with running water, kitchen, bathrooms, things that they can take care of themselves will greatly improve our community and our health for everybody. So the second question was what changes? I think I addressed some of that, but what would we advocate most strongly from policymakers? Obviously, again, I think to really ask these tough questions, to fight racism, not just to not be not racist, but to be anti-racist in our policymaking, to ask the really tough questions. Who is this policy serving? To analyze the outcomes of any decisions that are made, and to pivot quickly if decisions that are made are unequally affecting one community over another. I think we have a very smart community. We do have resources. How we use those resources and what questions we ask ourselves and each other and hold each other accountable to these questions, I think is what we need to do moving forward. And it needs to be a public dialogue. I had mentioned at Albuquerque Healthcare for the Homeless, we fumble through the conversation and the questions as often as we can, and we can do better. And I'm hopeful that we will continue to strive to do better throughout this pandemic with what we've learned and take it as a lesson learned going forward. But we need to be able to have this conversation together as a community. Need to be able to ask each other, what are your outcomes? Are you helping certain populations? What populations are you failing at helping? How can we help? I think that when we start having these conversations, we will all get better and people will experience more equity in our community.
That was excellent, Anita. Thank you very much for those tangible ideas and the public dialogue. I would second that and third that, absolutely. So I think we're gonna work more closely towards wrapping up. If anybody has more questions or gratitudes or anything, utilize our chats, resources. And Robert, I'll pass it over to you.
Awesome. Thanks, Mariah. Thanks, Anita, for that. I'm going to go back to you because I know you and I have talked about affordable housing for a long time. Could you talk a little bit about deep affordability in our communities? I know you're the chair of the Affordable Housing Coalition here, and what that could look like for Albuquerque especially.
Yeah, that's a great question, Robert. Affordable housing has a continuum, just like anything else, of what does affordable mean, who's defining affordable, and how tightly do we hold to that definition of affordability. It is really easy, especially coming off of the equity conversation, for us to slip into affordable housing at 80% of medium income, at a higher level of income. What we know is when you start looking at 50%, 80% and higher median income, we honestly do have, maybe not always sufficient, but we have units that cover people who are at that income range. Where our biggest gap is, and Hank, please jump in because I know you know this better than anybody. Our biggest gap in housing units are for people who earn 30% or less of the median income. And that is when we talk about housing, developing housing, we really need to ensure and safeguard that that housing is about deep affordability, that it is really about making sure that housing is accessible to those earning least in our community. And many of those individuals are working individuals. So it's not that we're talking about people who get paid and work and they still can't afford their housing. So we need to make sure we're taking care of our people. There are folks who live on Social Security income and Social Security disability income who absolutely cannot afford even what we call affordable housing, because it is developed at a rate looking at housing for all, so to speak, like when they're saying, well, everybody needs housing, students need housing, seniors need housing, that kind of conversation. There's no doubt that that's true. And if we create housing built with deep affordability, we can ensure that everybody has access to housing, more so than if we started an 80% fair medium income or some other indicator of affordable housing. So at the Albuquerque Affordable Housing Coalition, we have a lot of conversations about it's not just enough to talk about affordable housing. We need to make sure we're talking about deeply affordable housing that is also going to minimize and possibly eliminate the gap in affordable housing for communities of color who, again, are most affected by the lack of housing.
So much. I appreciate that. We'll shift to our last question, knowing it's about 9:48. And this is the question we usually close out with. And so it's, what can our community do for you today? We have some parts of it. So how can people help from home, especially? And then what are some creative ways that people can help nonprofits and or unhoused folks? And so we'll go ahead and start with you, Edward.
Okay, how can the community help us? Send more money.
Yes, send more money.
Yes, send more money. There's various ways people can continue to help. One is just really to support what the needs of the homeless are. There's one chat question that I saw in here about how to combat the myth of why there's anti-homelessness efforts. I think more people who were formerly homeless need to come forward and tell their stories so that people know that it can happen to anybody. There's that myth that most of the homeless are drug addicts, people with mental health issues, and yeah, there are a lot of them. But it really can happen to anybody. Homelessness can happen to anybody that falls on hard times, and I think more people who were formerly homeless need to come forward and tell their stories. But as far as what other people can do from home, right now we have a lot of people sewing masks for us, which has been great. People can cook dinner and bring it to the shelters. We've lost most of our volunteers. Actually, for a while there, we lost all our volunteers when the pandemic hit. We normally have probably 40, 50 people who were cooking dinner for us on different nights. Most of them stopped. Little by little, they're starting to come back. We have a few folks who are starting to come back to answer phones, help us with at the front desk. So I know it's still too early for a lot of people to come out and help us. But once things start getting better, please remember that we need more volunteers.
Thanks, Edward. Hank, is there anything you want to add to that other than more money?
Well, I just wanted to make sure people knew that wasn't a joke, but that's probably pretty obvious as well. Yeah, I think what Edward said is great. We don't use many volunteers at the Coalition to End Homelessness, but one thing people can do from home is to call their state legislator and express the importance of funding for housing for people who are experiencing homelessness. We got some great increases in funding in several ways at the last legislative session in January, and it would be a tragedy if all of that were to disappear, in this next session when they cut the budget. I think we need to it's a small part of the budget, but some of it is new money, and so new money is always in danger. We have money that's meant specifically for some of the shelters, like St. Elizabeth Shelter. We have some money going to permanent supportive housing for people with behavioral health diagnoses. That's about $4 million. That's the biggest chunk that we want to protect. And then we had $400,000 that helps us match our youth homelessness demonstration program in northern New Mexico to house homeless youth. And all of those are programs that are working well and need to be funded. So, anybody you don't have to remember all of that. Just let legislators know, particularly those on the finance committees, that it's important to you that we house people. I think one thing Edward didn't bring up that I've been thinking about is whether this might be a good opportunity for younger people to step forward and volunteer. I mean, we know that shelters have long relied on retired people to volunteer in many ways, and we know now is not a good time for retired people to be out and about more than they have to be. So young people who have a little bit of time, might be, better able, in a better position to volunteer for some of the homeless programs.
Thanks, Al, or thanks, Hank. I really appreciate that. And thanks for the call to call your legislators as well. If the special session is June 18th, so please, please, please call your legislators. I think for me, mine is Javier Martinez in the House and Senator Gary Ortiz-Pino in the Senate. So you can find that on newmexicolegis.gov. For that information, look up your legislators and give them a call as soon as you can this week and next week. And last, of course, Anita, could you round us out?
Absolutely. I will echo the call. I do believe philanthropy is a way to change our world, and giving and philanthropy does help redistribute wealth in our communities. So I will give a call out to that. I'll also say, if you have not, do your census, and please tell all of your community and your constituents to complete their census. Vote. This is a very important year for us. Vote always for people who care about affordable housing, access to health care, and a living wage, all of the things that will help eradicate homelessness. As Hank and Robert was saying, participate in civic engagement, call people, share your outrage. Protesting and marching is powerful and emotional and a very visual display of that outrage. But we should be outraged every day, and voting and civic engagement are great ways to share your outrage and to demand action for the things we know we can solve. Like homelessness is a very solvable problem. So I encourage you to do that, make the calls, send the emails, share your outrage today and every day until we eradicate inequities and homelessness and poverty in our communities.
Awesome. And with that, it's 9:55. We're going to allow people to reclaim their time. But in closing out, I just wanted to say a big thank you to all of our panelists today and for all the work you do in our community. I know there are a lot of people relying on your services to get into housing, and to continue the fight to advocate for housing is something we've been doing for years and years and years and years. So we continue that every single day. I hope the folks in the audience will do the same. I really appreciate that everyone showed up this morning. We had a really great audience today and really great questions and really great comments in the chat. I hope folks check out some of the organizations here, and also just check out some of the other homeless service agencies that are within the coalition and homelessness too. There's so much great work that's happening. Big shout out to our Impact and Coffee team. Mariah Harrison, our co-host, she's awesome. Destiny Logan over at Global Ties ABQ. Michael Green over at the New Mexico Farmers Marketing Association. Jamie Chester with Sync. Aaron Hielkema with the Grant Plant, and Juana Beta with La Red. Those folks do some amazing, amazing work every single day in their communities and across the board, and they make this happen on a volunteer basis thrice monthly of the first 3 Tuesdays of the month. So join us next week for Impact and Coffee on June 16th. We have a special conversation with the arts sector. So we'll have Gabrielle Ubayez over from the Urban Enhancement Trust Fund. She's the chair of that commission at the city. We'll have Shel Van Eden Sanchez over at Cultural Services, and we'll have I can't think of his name now. Francis, thank you so much. Who is the owner? One of the co-owners of Red Planet Comic Books over here on Park Avenue, amongst various other things that he does for Indigenous brothers and sisters across here in New Mexico and across the country as well. So join us on the 16th for Impact and Coffee at 9 a.m. We'll be on Zoom again. Keep an eye out for the YouTube link, which will be probably available within about a day. Share that with your friends, share that with your networks too, and just tell them that Impact and Coffee happens almost every week now. We are probably going to be doing virtual for some time until we have more relaxing of the stay-at-home order, but that's okay. We love being here virtually with everyone and talking with everyone virtual, and also connecting with more folks across the state. We've had some opportunities for that in the past, and I hope that we could do that even further. I think that's it. Mariah, is there anything else you want to do to close out?
I was just mentioning in the chat that anybody who's not already receiving our newsletter, you can request that from us. It goes out just like Robert was saying. If you're interested in speaking, we can still talk about that. We're still putting together themes for the next couple of weeks. I think that's about it for me, and thanks everybody for coming.
Awesome. Well, with that, we'll wish everyone a really great Tuesday and a really great rest of your week. I hope everyone stays safe and stay healthy, and may all your lights be green. We'll see you soon, everybody. Take care.
Bye.
All right, thanks.
Bye, thank you.